Anafi TV on the dot,
where knowledge is
bringing
enriched,
you the latest
hottest, and the most accurate
scientific ideas. I am Perijan Tuparan.
Tiffany Claire Tere.
And Abigail R. Serrato.
First on our list, reproductive system. This system plays an essential role in the development of the structural and functional differences between males and females, influence human behavior, and produce offspring. And it has its general functions. And to discuss the general function, let's have Miss Jura. Jura.
Thank you, Tim. Now we are here live at the University of San Agustin. As you can see, there's a flood caused by the heavy rains, but that's not the case. We are here to discuss about the functions of the reproductive system. First, the production of gametes, where sperm cells are produced in the testes and oocytes in the female. Second, fertilization. The reproductive system enhances fertilization of the oocyte with the sperm. The duct system in males nourishes the sperm, and the female reproductive system receives the sperm and transports them to the fertilization site. Third, development and nourishment of a new individual. The female reproductive system nurtures the development of a new individual in the uterus until birth and provides milk after birth. Lastly, production of sex hormones. Hormones produced by the reproductive system control its development gender-specific body form. These hormones are essential for the normal function of the reproductive system. This is all for my report. Back to you guys.
The male reproductive system is composed of testes, a series of ducts, supporting structures, and accessory glands. Collectively, all of these structures are called male genitalia or male genitals. Under the supporting structure of the male reproductive system is the scrotum, and we shall have Katrina to discuss further about scrotum. Katrina?
Good morning, Teddy. We are here today at the University of San Agustin, and as you can see, students are busy studying for their practical exam on reproductive system. But before asking them some questions, let me discuss the scrotum. Is a sac-like structure containing the testes. It is divided into the right and left internal compartments by an incomplete connective tissue, the septum. It is externally consists of skin. Beneath the skin are layers of connective tissue and layer of smooth muscle called dartos muscle. In cold temperatures, the dartos muscle of the scrotum contracts, causing the skin of scrotum to become firm and wrinkled, and thereby reduces the overall size of the scrotum. And at the same time, extensions of abdominal muscles in the scrotum called cremaster muscle. So now, let me ask one of them about how they feel on their practical exam. Excuse me, miss. So how are you feeling right now?
I feel nervous.
So, do you think the practical exam would be easy?
I hope so.
Well, good luck on your practical exam, and I hope you'll get a high score.
Thank you.
So, this is Katrina April Taklas reporting. Back to you, Ken.
So thank you, Katrina. The temperature affects scrotum contraction. What about testes? Do you know what testes is? Do you know that sperm is produced in testes? What does it look like? May we call on Jaw to explain further.
Good day, everyone. We are here at the Umagang Maysigla Health Center, and we have a patient here who was accidentally hit by a ball in his testes. Excuse me, sir. Can you tell us exactly what happened?
I was playing basketball and my balls were hit by another ball.
So, Doc, how's the patient?
He's fine. He just fainted. Because of too much pain when the ball takes his testes.
Thank you, Doc. Bye. What is testes? Do you know anything about it? Let me tell you. Testes are male gonads. These are oval organs about 4 to 5 centimeters long inside the scrotum. The outer part consists of thick, wide connective tissue capsule. The testis contains lobules, and these lobules contain seminiferous tubules, in which sperm cells are developed. Delicate connective tissue surround this lobule,
which contains Leydig cells that secretes testosterone and also contains sex cells and Sertoli cells which nourishes the germ cell and produce number of hormones. That's all for today. This is Juana Rose A13 reporting. Back to you, Ted.
Thank you, Job. So, let's move on. Our next topic would be for additional information only, and this will be about spermatogenesis. And we'll have Julie to tell us something about this. Julie?
Yes, Daddy. So, spermatogenesis is the formation of sperm cells. The most peripheral germ cell are spermatogonia or the underdeveloped sperm cells, which divides through mitosis. Some daughter cells that are produced remain as spermatogonia and continue to divide by mitosis, but others form primary spermatocytes, which divides by meiosis and become sperm cells. This primary spermatocyte has 46 chromosomes, and it passes through the first meiotic division to produce 2 secondary spermatocytes. Then it will undergo again for the second meiotic division to produce 2 smaller cells or spermatids with 23 chromosomes. The spermatid undergo changes. It develops a head, a midpiece, and a flagellum to become sperm cell or spermatozoon. The head contains the nucleus, and anterior to this is the acrosome, which contains enzymes that are released during fertilization and necessary for the sperm cell to penetrate to oocyte, then released into the lumen of the seminiferous tube.
The testis is organized into a network of seminiferous tubules. Within these tubules, spermatogenesis occurs. Spermatogenesis is the production of mature haploid sperm cells through meiotic cell division. A spermatogonium deep in the epithelium of the seminiferous tubules gives rise to a primary spermatocyte. This cell contains 46 chromosomes. A primary spermatocyte undergoes the first meiotic division, producing 2 identical secondary spermatocytes. Each secondary spermatocyte contains 23 chromosomes. The secondary spermatocytes complete meiosis, giving rise to haploid spermatids. Each spermatid contains 23 chromosomes. The spermatids then develop into mature sperm.
From spermatogenesis, let us move on to another organ, the duct, and we must be acquainted
We're here live at the Paaralang Elementarya na Magaganda. And as you can see, Professor Nasir Jan Villaferte is having his sex education class. He's discussing some of the organs of the male reproductive system. Let us hear him.
So we'll start with the male external genitalia. So class, do you know what the penis looks like? So this is how the penis looks like. This is the cylindrical organ, the male, outside the body. And if this is the penis, this is the scrotum, where the testis inside is found. So sideways, it's like this. The pouch is called the scrotum, but the balls are called the testes, and this is the penis. Got it?
Yes. Yes. Yes, sir.
Sir, how many balls are there?
It's not balls, it's testes. Oh, there are 2 testes, plural testes. So this is the difference between the circumcised penis and the uncircumcised penis. The circumcised penis has the the foreskin removed, while the uncircumcised penis still have the foreskin. So never mind about this one. This is, parts of the penis are called, this is the shaft, and this is the glass penis. And this is called the urethral meatus. This is the crown. At the back side of the penis, looks like this. This part is called the frontal lobe, this piece of skin right over here. And this is the scar caused by the circumcision. So moving inside, this is the penis. These chambers are called the corpora cavernosa. And this region around this is called the corpora spongiosum. And when the male gets excited, blood from the blood vessels will rush into the penis and causing the penis from this state going to this state. In case the penis becomes erect.
And that's my report for today. This is Ira Shakes Enriquez reporting. Back to the studio.
So just keep on tuning in, because Anna VTV will be right back after this break.
Dysmenorrhea? No more. Use Buscopan Venus.
secondary sexual characteristics, spermatogenesis, and sub-aspects.
Thank you, Ab. We are live here today at the USA Ground Lobby, and here with us is Dr. Genevieve Tubo. Good morning, Doc. Well, Doc Jen is the director of Tubo General Hospital in Antique and a well-known OB-gynecologist. So, Doc, can you tell us something about the regulation of sex hormone secretion?
Yes, of course. The hypothalamus of the brain, anterior pituitary gland, and testes produce hormone that influence the male reproductive system. Gonadotropin-releasing hormone is released from neurons in the hypothalamus and passes to the anterior pituitary gland, which causes cells in pituitary to secrete two hormones, luteinizing and follicle-stimulating hormone. Luteinizing hormone binds to the Leydig cell in the testes to secrete testosterone. Follicle-stimulating hormone binds to Sertoli cells in the seminiferous tubule and promotes sperm development. It also increases the secretion of hormone inhibin.
Thank you, Doc. That's for today. This is Juana Rose Azeltine reporting. Back to the studio.
What are the male sexual behavior and what is infertility? Do you want to discover it? Let's hear it from Jenny.
Good morning, Abby. We are live here today at the Pamilihang Agustinan, and as you can see, everyone is much noisy and busy. Infertility in females. Causes of infertility in females include malfunctions of the uterine tubes, reduced hormone secretion from the pituitary gland or the ovaries, and interruption of
Next up
implantation.
is the female reproductive system. But before that, let us have this break. We'll be right back.
Having a lot of stress? No more time for sex? Problems of having a baby? Then take Tonkat Ali. Tonkat Ali boosts sex drive and sex endurance. So buy now and make babies.
And we are back, and you are now watching NFE TV on the DAT, where knowledge is enriched. Now, let us move on to female reproductive system. The female reproductive organs consist of ovaries, the uterine tubes or fallopian tubes, the uterus, the vagina, the external genitalia, and the mammary glands. The internal reproductive organs of the female are located within the pelvis, between the urinary bladder and the most conspicuous in the broad ligament, which spreads out on the both sides of the uterus and attaches to the ovaries and uterine tubes. To further discuss the different organs of the female reproductive system, let's have Katrina. Kat?
Yes, Tiff. Ovaries. These are two small organs suspended in the pelvic cavity by ligaments. A layer of visceral peritoneum covers its surface. Loose connective tissues makes up its inner part, where blood vessels, lymphatic vessels, and nerves are located. Its outer part is composed of dense connective tissues and contains ovarian follicles. These ovarian follicles contains oocytes, which are female sex cells. That will be all. This is Katrina April Taclas reporting. Back to you, Tiff.
Thank you, Kat. And now let us watch a short video clip about oogenesis and fertilization.
At puberty, a woman has about 400,000 primordial follicles, each of which contains a primary oocyte surrounded by a single layer of granulosa cells. After puberty, 5 to 12 primordial follicles develop into primary follicles each month. Only a few primary follicles continue to grow, developing a fluid-filled cavity called the antrum. Eventually, one becomes dominant. At the time of ovulation, the mature follicle moves close to the surface of the ovary. The fimbriae lifts off the expelled oocyte for potential fertilization.
from that. So let's proceed to uterine shoot and uterus.
Yes. So, we are here today in one of the prestigious schools here in the city. I will tell you something about uterine and uterus. Uterus is shaped like an infant ear. It is a hollow muscular organ with thick walls, and it has a glandular lining called endometrium. It is a hollow muscular organ in which the fertilized oocyte develops into a fetus. It receives the ovum through the fallopian tube, in which retains it during development and is formed. It is where the fetus is expelled during labor. A muscular enclosure at the top of the vagina that holds the fetus during pregnancy. An organ in women that holds and nourishes the growing embryo and fetus. It has 3 stages: the body, or the upper part, that is the cervix. That's all. This is Irene Silurikas reporting. Back to you, Trey.
Okay, thank you, I. What is vagina? I know we are all familiar on this word, but to further understand, let us call Julie.
Thank you, Tiff. I am not alone today. Together with me is Dr. Ran Valenzuela. Hi, Doc. So, Doc, can you tell us something about external genitalia?
Okay.
But before that, let me tell you first about the vagina. The vagina is the female organ of copulation. It receives the penis during sexual intercourse, allows menstrual cycle and childbirth. The wall of the vagina consists of an outer muscular layer and an inner mucous membrane. The muscular layer is smooth muscle that contains many elastic fibers to increase in size, to accommodate the penis during intercourse, and stretch greatly during childbirth. So I think Dr. Ran Valenzuela is now ready to discuss to us about that external genitalia. Doc?
Thank you, Julie. So, the vulva is a collective term, and it refers to the external part of the female genitalia that consists of the vestibule and the surrounding structures. And one could not miss the sight of a small erectile structure called the clitoris at the top. That consists of the shaft and the distal glands. The clitoris is well supplied with sensory receptors and is made up. The region between the labia majora is called the pudendal cleft, and the region between the vagina and anus is called the clinical
Thank you,
perineum.
Doc. And this is Julian Titabigan report.
Thank you, Julie and Dr. Ran. From vagina, let us move on to another topic, the mammary gland.
Good day. I am back again and I have something to tell you. Did you know that mammary glands are organs of milk production? They are located in the breasts and are modified sweat glands. Adult female breasts contains mammary glands of 15 to 20 glandular lobes covered by adipose tissue, which gives form to the breast. Each lobe possesses a single lactiferous duct that opens independently to the surface of the nipple. In milk-producing mammary gland, the ends of small ducts expand to form secretory sac called alveoli. Myoepithelial cells surround the alveoli and contract to expel milk from the alveoli. And we are here today at Iloilo Summer Best Hotel, wherein a seminar organized by some cancer survivors for their fight against breast cancer. And let us all watch this video to show our support.
The public perception is that breast cancer is a pretty pink disease with survivors, treatments, and death rates trending in a favorable direction. In 1991, approximately 44,000 women died from the disease in the United States alone. This year, about 40,000 women and 400 men will die from it. That's one death every 14 minutes. With current attitudes, treatments, and institutions unchanged, projections indicate that by 2030, the annual death rate will exceed 800,000 worldwide. We can do better. People are not statistics. Every number has a name. Every patient counts. We want to hear from you. We care about your stories, what's worked for you and what hasn't. Are you a patient or a family member? We are here to help. Are you a service provider, a doctor, or a therapist? Let's work together. Breast cancer isn't pretty in pink or any other color. Loved ones, patients, and caregivers already know that. It's time that the public and the legislators charged with serving them know that too. Advocates for Breast Cancer is focused on research, education, patients' rights, and getting rid of breast cancer once and for all, because no one should have to live with or die from this disease. We can't change the past, but together we will change the future. Advocates for Breast Cancer, we're here for you.
That's it for now, guys. But don't change your channel. Keep on tuning with us because we will right back.
Excuse me, miss. You have
Lonely is a day when I'm not with you. Lonely is a day, ain't no light shining through.
Don't want your day to be spoiled? Use Charmaine. It has breathable pads and it's super absorbent. You don't have to worry about leakage. Have a happy period.
And we are back. You are now watching NFE TV on the dot, where knowledge is enriched. As in male, female reproduction is controlled by hormonal and nervous system mechanism. Puberty is a period when a female is capable of reproducing sexually, marked by maturation of genital organs and the occurring of the menstruation. We will have Julie to understand deeper this matter. Julie?
Good day. Let us learn more about puberty. The initial stage that results in puberty is most likely maturation of the hypothalamus. In girls, puberty, which typically begins between ages 11 and 13 and is largely completed by age 16, is marked by the first episode of menstrual bleeding, which is called menarche. During puberty, the vagina, uterus, uterine tubes, and external genitalia begin to enlarge. Adipose tissue is deposited in the breast and around the hips, causing them to enlarge and assume an adult form. In addition, pubic and axillary hair grows. The development of sexual drive is also associated with puberty. The changes associated with puberty primarily result from the increasing rate of estrogen and progesterone secretion by the ovaries. Before puberty, estrogen and progesterone are secreted in very small amounts. At puberty, the cyclical adult pattern of hormone secretion is gradually established. Before puberty, the rate of GnRH secretion from the hypothalamus and the rate of LH and FSH secretion from the anterior pituitary are very low. Estrogen and progesterone from the ovaries have a strong negative feedback effect on the hypothalamus and pituitary. After the onset of puberty, the hypothalamus and the anterior pituitary secrete larger amounts of GnRH, LH, and FSH. Estrogen and progesterone have less of negative feedback effect on the hypothalamus and pituitary, and the sustained increase in estrogen concentration has a positive feedback effect. The normal cyclical pattern of reproductive hormone secretion that occurs during the menstrual cycle becomes established. This is Julian Titapican at your service. Back to you, Teddy.
As an overview, menstrual cycle is a series of changes that occur in sexually mature, non-pregnant women and result in menses, specifically referred to uterine cycle, but is often used to include uterine and ovarian cycle. Let us have Jura to explain this further, and also she will talk about menopause. Jura?
Menopause. When a woman is 40 to 50 years old, the menstrual cycle becomes less regular and ovulation does not occur consistently during each cycle. Eventually, the cycle stopped completely. The cessation of menstrual cycle is called the major cause of menopause is age-related changes in the ovaries. The number of follicles remaining in the ovaries of a menopausal woman is small. In addition, the follicles that remain became less sensitive to stimulation of FSH and LH, and therefore fewer mature follicles and corporallotia are produced. This is all for my report. Back to you, Teddy.
NFE TV will be right back after this break. So those were the latest,
The hottest and the most accurate
scientific information here only at NFE TV on the dot,
where knowledge is enriched.